states and coalesce around one another as well.
I can't thank the Congressman enough for his leadership on this issue and for inviting me back to New Mexico. I think that when you look at those numbers for the size of the state and the devastation that drugs have caused, it is, as he said, a significant wake-up call. But what I thought was so impressive with having 150 or 200 people in that meeting, in every age and from all walks of life in that meeting, is that it was just such a clear expression that we're not powerless, and the people in the state and these communities are not powerless to deal with the problem of drugs, whether it's working through the prevention programs, the people that were running treatment programs there, and in particular the coalitions that have come together. So I was honored to be with you, and thank you very much.
Appreciate that, Director. And just especially to highlight the youth component, I think you may have heard some of the youth express their concerns in the community, their ideas and suggestions, and they're going to be the most powerful force when it comes to peer support, peer outreach, but making something happen, especially if we're really identifying the systemic issue and trying to change behavior and create that awareness. So if there's any questions.
Some of the loudest applause we saw today was in comments with reference to legalization and decriminalization of drugs. Why is there still such a huge gap between federal policy and what's emerging at the local and state level in terms of really changing the whole approach, the whole paradigm on drugs?
Well, I think even you can see where there's sometimes even a difference of opinion that takes place from the federal approach, even with medical marijuana, as with state policies associated with medical cannabis as well. And therein lies an opportunity to begin to create some realization, but to support even efforts where there's still studies that are taking place to bring them around. I think, even in the case of California with what occurred, people are paying attention across the country, but here in New Mexico, we know that the law was passed and that there's a difference in opinion even with what's happening with some at the federal level, but to see what we can do to work at the Department of Justice level and continue to have the conversation is critically important. The more that you talk about any particular issue, there's heightened awareness around it, and then that's how policy changes come about. So to engage more people in the community, keep talking about whatever policies are important to them, whatever issues are important to them, is going to be key to creating a conversation around it, and I think that's what we need to continue to do.
I think it's easy to say that we can keep talking about it, but meanwhile, the lives of countless people are being destroyed by the drug war, and it's mainly people from my generation. I think there's a ton of frustration that our lives are being lost either in prison or suicide or death through the violence that the drug war brings to our communities.
It's a question we could probably end up spending a lot of time on. The facts just don't really support a lot of what you said, whether it's the changes in sentencing policy. And there were a lot of people sentenced, but it kind of ended around 1995 for filling up the prisons. It was the abolishment of parole and minimum mandatories that the research shows continued to drive that on. Marijuana is not a benign drug, and so legalization is not an answer to a particularly complex public health problem.
And I think the question is, what can we do to curb violence as a whole around the world? Whether it's violence, sadly, with what they're doing in a particular area with the cartels, or even violence in our own communities when we talk about domestic violence. It's something that it brings ills to a community, and we have to have a fundamental shift in just our approach to things. So appreciate the question, and it's a larger conversation, but the more that people talk about whatever it is that's important to them and that they're passionate about, it creates heightened awareness, and we need more involvement from the community, even from a voting perspective. People need to get out and exercise their vote and find elected members that represent their views, and hopefully, whatever the issue or the policy may be, it'll increase voter turnout. And there inherently, as we talk about a representative voice, that's what it's going to take, so whatever the issue may be.
With regard to the comments earlier about the medical marijuana programs, specifically in light with what's been happening in California and Colorado,